Hello and welcome to this short video about the use of Penthrox, or the actual name of the drug, methoxyfluorine. I'm going to stick to the name Penthrox. That's the trade name of the whole item that's being used. Now, I say a short video because if you are using Penthrox, then you need to undertake training, which is by your organisation, and you need to make sure you follow their standard operating procedure for the use of it. So different organisations will vary, and I cannot advertise enough how important it is that you undertake your organisation's training and adhere to their standard operating procedure. So this is just a generic overview of the kind of concept. What I've got here is the training pack, and the real pack. So this is the training pack, which I'll go through first. It's slightly different in colour, as you can see, a lot more green on the actual real pack, but it has the kind of instructions on the back. So I've got these little cards as well, and I think these are really important. So what the Penthrox has come up with is this check all kind of concept. So these are the things you need to check before you use the Penthrox as an analgesia, as a pain relief. Really quite basic. We're only going to use it on adults, so the age of 18 and above. It's only going to be used for traumatic injuries, and only if they haven't kind of used the Penthrox recently. So traumatic injuries for adults over the age of 18, and that's it. So it keeps it nice and simple. So it's not an ongoing analgesia that they're going to be using. Penthrox has been around for almost 50 years now. Back in 1974, it was introduced into Australia, commonly known as the green whistle. Been in the UK now for a few years, and there's quite a lot of different organisations now using it, which will come under a medical director, have a standard operating procedure. Make sure you read that to do it. So this checklist is really good. I'm not going to read through all of them, but essentially you need to check the patient has got no cardiovascular instabilities. They haven't got a hypersensitivity to the methoxyfluorine, the Penthrox, the actual drug there. Establish or genetically suspect hypothermia or a history of severe adverse reactions to inhaled analgesia, consciousness reduced, that includes alcohol, kidney impairment, aged below 18, lung or respiratory impairment, liver impairment, or last administration of methoxyfluorine. So again, there's the kind of this kind of check all before you do it. So really, really good advice that you should follow on there. Plus, this other little card is what you can give to the patient, because there are some effects. So if we think about what this is an inhaled analgesia. So if you like, the vapors from the liquid will go into the lungs, into the respiratory system. That will then transfer into the blood, the circulatory system, and that then goes to the right areas to provide the analgesia. But because it's in the blood, it needs to be filtered out. So it will go to our normal circulatory filtering systems. It will go through our kidneys, through our liver. So any patient with filtration problems, so kidney problems, liver problems, etc., they will have or potentially could have adverse effects. So they're the ones we've got to be cautious of. The only other kind of thing that this might cause is some kind of dizziness, possibly headaches, possibly vomiting or nausea and stuff. And kind of, if we go worst case scenario, maybe some reducement in blood pressure and cardiovascular. So hypotension, bradycardia, and may go into the respiratory system as well. But they're kind of rare kind of effects. So let's have a look at the actual kit. So here it is. This is a training kit. Let's open this up and see what we've got inside. So as you can see, This is green, known as the green whistle, a nice little strap on there. It's got the charcoal on top, and it's got the actual drug itself. There's also a plastic bag. So let's just pop out the main part, the green whistle. Let's get that out in a second. Plastic bag to dispose of everything at the end. And as you can see, I've not actually got the real drug here, so this is just an empty bottle for training purposes. So we'll have a look at that. If when yours arrives, it hasn't got this carbon chamber on the top, that simply just pushes together, and it is important that that is always attached when you're going to use that. Hand strap for the patients to put around, just in case they drop it. In the end here is a bit that you can use to undo the lid of the bottle. So if I just open up my training one, so I've just got the wrapper around the outside, so I can just pull that down, got a plastic coating on. But if I just pop that lid in the end and then turn it, just get the plastic cover off first, and as I turn it, the actual bottle comes out without the lid. Obviously, I've got that there. You don't want to spill any of it. So what I normally do in real practice is just put it in, twist it, which loosens the lid, and then take the rest off. Now, what we've got inside here is an actual paper filtration. So if we hold this at about a 45-degree angle, we can then pour the liquid in and swirl it around. What we're making sure is this liquid, which is 3 milliliters of the actual drug. So if we pour that in, we want to make sure we swirl it around so it gets onto all of that absorbent paper around, so that the patient can breathe it in. Once we've done that, again, we've gone through that check all with the patient, and the patient can pop it onto their wrist. They can then start to breathe it in, just little breaths. It will probably take 6 to 10 breaths before they can start to get an effect, and they should get an effect after those 6 to 10 breaths. This will have a maximum effect at around about 15 minutes into inhaling it, and it will probably last for about 25 minutes if they're breathing through it continuously. If they take intermittent breaths, it may last a lot longer, so up to an hour or so. And simply, the patient's going to pop it in. And they're just going to breathe normally through it. You'll notice they have to breathe out through it as well. That is important, and that's why we've got this carbon kind of filter on here, because that's what it breathes out through, is to reduce that drug going into the atmosphere. So just putting it in their mouth, normal breaths. 6 to 10 after about 15 minutes, full effect. If it's not sufficient for the patient, then on the top here is a little hole. If the patient themselves covers that up, then instead of them breathing in a mixture of air, then they're going to breathe in only through the main green whistle, and they take more of the actual inhalement of the drug. It's as simple as that. So that can be used if they need some kind of extra, but as standard, they won't need that, just breathing in and out through it. It's quite simple. Instructions are on there. Once they're kind of finished and they're done with it, the plastic bag to dispose of that into there. And the drug as well, that can all be disposed of and gone. Don't forget, you've got the patient card there. This is the actual real drug, and as you can see, there's 3 milliliters of the methoxyflurane in there, so the actual drug in there. So this is the real one. Got the bottle, got the Penthrox, which is the inhaler, and the carbon filter, etc. on there. Again, a reminder of how to use it. And this is where I would encourage, make sure you've got the check-all list with it and the patient card that you can give to them afterwards. So same thing with all kind of medications and drugs. Make sure you check the expiry date, etc., etc. Let's just open this up and see what this looks like for real. So this looks exactly the same. So as you would expect with a real drug, it's actually got an expiry date, etc. on there. It's got the same plastic bag. It's got the same carbon bits. Again, if that came off, it literally just pushes together, but most come with it on. It's got a reminder on here. You've got the same bit at the end there for the cap, so the bottle can go in to loosen it, to take that off. You've then got the paper on the inside, so 45 degrees, swirl it around, get it in there, and then wrist on, they can hold it, some breaths through there. It is important that this patient that you're ministering to is 18 and above, so adults only. That's really important. It's only for traumatic patients, and it's like a new onset of trauma, so it's not chronic pain or anything else. They can have the 3 milliliters of the drug. They can have a second dosage, so they can have up to 6 milliliters in one kind of sitting, if you like. But if they had some the day before, then we should avoid using this drug. So it should be a couple of days, and a maximum of 5 dosages, so 15 milliliters in any 1 week. So if a patient was unlucky enough to have a traumatic injury earlier in the week and then they've had this, you may consider using an alternative medication. You also may want to look at your pain scores. Again, different standard operating procedures would dictate what you kind of use. I would suggest anything from a moderate to a severe pain. So a score of above 4, so 5, 6, 7, 8, 9, 10, those kind of scores we're looking at. And again, we should have maximum effect within about 15 minutes of using that. So I'm hoping that's kind of helped, that kind of green little whistle, Penthrox, pain relief. As I say, always do the training. You can see up behind me the official kind of guide for it. You can go onto their website, so just Google Penthrox training, and there's a lovely little online training course that you can do for yourselves. I would highly recommend that. The more training you can get, the better, but always follow your organization's standard operating procedure, because it will be documented exactly how and when you should use this. So do follow your organization. That's really, really important. I hope this little video has been of some use to you. And if you want any more videos, just leave me a note below, and don't forget to give me that thumbs up. Cheers for now.